Okay, well, welcome everybody. Let's get started today. My name is Joe Simonetti. I'm the Director of Education for the Anschutz School of Medicine Firearm Injury Prevention Initiative. This is our regular webinar series in which we highlight collaborative, innovative approaches to the prevention of firearm-related harms in Colorado and nationally. And I'm so excited, specifically for today, to be here to introduce and see my friend and colleague, Dr. Erin Kelly, who I'll introduce more in just a moment. Before I do that, note the QR code on the upper right corner of her slide. If you scan that and sign up for our newsletter, that will be one method for you to sort of stay in touch with the Firearm Injury Prevention Initiative's efforts, as well as get looped into our regular webinar series. One of the reasons I am really excited about this topic today and to hear more about Dr. Kelly's work is, one of the most fundamental necessities for really developing evidence-based policies and interventions to prevent firearm injuries is knowledge, is data. And if you sort of track the world of firearm injury prevention and research and policy, you're probably already aware that that's one of the biggest challenges that we have, certainly at the national level and in particular at the state level. There are not a lot of good methods, data sources for us to have a very good understanding of firearm access and some of the risk factors that go into predicting the firearm events that impact our daily lives on many different levels. And that's where Dr. Kelly and the COFIPs come in. So Dr. Erin Kelly is the Director of Research and Evaluation with the Firearm Injury Prevention Initiative and research faculty with the Injury and Violence Prevention Center at the Colorado School of Public Health. She has experience in public health research and practice, specializing in firearm injury prevention, suicide and violence prevention, and upstream prevention focused on the social determinants of health. Dr. Kelly uses community-engaged and mixed methods approaches in her research and has extensive experience in translating, disseminating, and supporting the implementation of evidence-based strategies, programs, and policies into practice environments. So without further ado, I am going to pass this off to Dr. Kelly, and she can begin her presentation. Thank you.
Thank you so much, Dr. Simonetti, and thank you all for joining us today as we discuss findings from the Colorado Firearm Injury Prevention Survey, or what we refer to as COFIPs. We believe these findings can inform approaches to educating Coloradans on firearm harms and working collaboratively to prevent injuries and deaths involving firearms. By firearm harms, which I will use throughout the presentation today, we mean concerns like death and injury involving firearms, theft of firearms, and even the emotional impact of experiencing threats from firearms or loss of loved ones or community members that involve firearms. COFIPs is conducted by the Firearm Injury Prevention Initiative at the University of Colorado School of Medicine and the Injury and Violence Prevention Center in the Colorado School of Public Health. We are so grateful to have a state that invested in COFIPs, having received funding from the Office of Gun Violence Prevention at the Colorado Department of Public Health and Environment. I first wanted to start with the why we should collect, or why we should talk about and understand firearm harms, and why we need to collect data about the issue in our state. In the United States, firearm-involved deaths have recently surpassed deaths that are a result of motor vehicle accidents, and firearms remain a leading cause of death among children and adults alike. In 2021, 48,830 people died from firearms in the United States, and 2% of those who died were from Colorado, a total of 1,064 individuals. Even more, for every person that died, an additional 3 to 4 people were injured by firearms. Colorado has a higher rate of firearm deaths compared to the US rate, and it is the 21st highest firearm death rate in the United States. To break this down, this means that in the hour we will be on this webinar together, 5 to 6 people will die from firearms and 20 people will be injured in the US. And over the course of the day today in Colorado, 3 people will die and 10 people will be injured involving firearms. While I'm here to report on data, and those are often numbers, we must remember that these represent people around us in Colorado, our community members, neighbors, friends, and loved ones who have lost their life, were injured and are now physically and emotionally healing, and those family members and friends who grieve for those who died or were injured. The impact on individuals, families, and communities is profound, and it is why we believe understanding and addressing firearm harms is a critical public health concern of our time. The public health approach is visualized here. Using a public health approach is important in addressing firearm harms as it uses data to inform strategies and program development. It then tests those strategies and programs that are being implemented so we can scale up the effective ones to be used broadly in our communities so we can successfully prevent firearm harms. COVIPS helps to enhance Colorado's ability to do step 1 of surveillance and step 2 of identifying risk and protective factors, which are challenges that individuals and communities experience that sometimes lead to certain communities being more or less impacted by firearm harms. Even at the federal level, we have very limited data to help us understand the impact of firearm harms. In addition, understanding people's perspectives on their experiences with firearms or firearm harms, or their opinions about education and prevention efforts is even more limited, especially at the state level. COVIPS is intended to fill those gaps and thus, 1, advances our understanding of firearm-related topics in Colorado, 2, provides the opportunity to monitor trends in firearm-related experiences or perspectives over time, and 3, informs education and prevention efforts that are collaborative, relevant, and responsive to Coloradans' desires. Let's dig into more about what COVIPS is, what we asked, and how we administered the survey. While we shared the results of the inaugural survey today, we plan for COVIPS to be an annual survey, but will serve slightly different purposes in the odd and even years of administration. In the odd years, which includes the 2023 data we're presenting today, we will send out a core survey, which will be consistent questions like we shared that give us a broad and representative perspective on the impact and prevention of firearm harms among Colorado adults. To emphasize once again how little data exists at the state level about these issues that we are aware of, COVIPS is only the 3rd state-level representative survey to try to understand these issues, joining California and New Jersey as highlighted here. While New Jersey's was only focused on those who access firearms, Colorado and California's were comprehensive and asked opinions of the general adult population. California's survey is more broadly aimed at capturing exposure to violence and its consequences, while Colorado's is more directly focused on the impact and prevention of injury and violence that more specifically involve firearms. In addition, Colorado's COVIPS also takes a step further by adding in 4 regions within the state where we collected representative data to provide more localized information, which I'll show in the next slide. In even years, COVIPS will dig a little deeper and will be a specialty survey that uses some of what we found in the odd year findings to understand impacts of firearm harms and opportunities for prevention among specific groups, such as those who are most impacted by firearm injury and death, or groups that might support possible and education and prevention efforts like public health, healthcare, or law enforcement. These are the 4 regions within Colorado where we also have representative data for those regions. Denver Metro, Pikes Peak, the North Central and Northeast combined areas, and the final region is in the other areas, which is the Northwest, West Central, Southwest, and stretching over to the Southeast. We asked questions that allowed us to explore 3 primary areas that I will present on today related to the impact and prevention of firearm harms in our state. First, we asked about firearms culture, which is individuals' familiarity and exposure to firearms, then access to firearms and firearm safety and storage behaviors within homes that have firearms. Second, we asked about individuals' concerns about and experiences with firearm injury and violence. And third, we asked about awareness of and opinions on practices and policies aimed at building protective environments to prevent firearm harms. COVIPS was administered online from May to June in 2023. The survey was available in both English and Spanish. We worked with Ipsos, a global research firm, to administer the survey to their knowledge panel, which is an online research panel with people chosen using randomized sampling methods. Ipsos then recruited additional participants in Colorado who increased the geographic and demographic representation of the participants in Colorado. We received 1,520 responses, but then weighted the data set to be representative of adults in the state of Colorado and in those 4 regions. By weighting the data, this allows me to use language like Coloradans believe or Coloradans say, which is what I will use to present the findings in this presentation. So let's dig into what we found. My goal is to frame all the findings I present with why each is important, given what we know from research in the field of firearm injury prevention and what the COFIPS data tell us about these issues. Given our limited time today, I will only focus on state-level results of some, but not all of the findings. Additional findings and breakdowns of the data by different demographics, such as race or ethnicity, veteran status, or identity groups, such as whether individuals have a firearm in their home or not, and the 4 geographic regions are available for download from the COFIPS website, which is cofips.org. In the downloadable data set, we also include a metric called confidence intervals. These are important as it helps us communicate how certain we are about the accuracy of our estimates. To ease interpretation, I only report on our estimates in this presentation. And finally, there will also be QR codes on some of the slides that provide you with additional information on the findings or relevant topics. While discussions about firearms and what is best to prevent firearm misuse can be contentious, we all agree that we don't want anyone to be injured or die from firearms. We feel these findings help demonstrate the diverse backgrounds, opinions, and perspectives of Coloradans in a frontier state where many were raised with or have access to firearms. As you can see here, 1 in 2 people in our state grew up with firearms, 44% have firearms in their home, and almost 1 in 3 people personally own firearms. Given the context that many access or own firearms in our state, we can talk about the opportunity this presents for prevention of firearm harms. We know that those who have access to firearms are at increased risk of theft, as well as injury and death. The increased risk of injury and death is because these households simply have easiest access to a lethal device that could unintentionally or intentionally injure or kill themselves or others. Given that we know that many in our state have this access, we ask questions about how homes with firearms store their firearms. Secure storage in and out of homes can help save lives by preventing unauthorized access. We also know these household decisions can be dependent on their life circumstances, so we wanted to understand these important differences. Given the high level of access to and ownership of firearms in Colorado, we wanted to see if Coloradans are aware that access and storage are related to risk of firearm harms. These data demonstrate that 58% are aware of how access to a firearm alone can affect risk, but almost 9 in 10 people knew that securely storing your firearms can reduce risk of injury or death. An aspect of secure storage is that households with firearms can voluntarily and temporarily remove their firearms from the home if someone is in crisis. 71% of Coloradans agreed this was something that could reduce risk of injury or death. We also thought it was important to understand who personally owns firearms in Colorado, as this information can help tailor education and support for groups who may have higher risk of injury or death, including suicide. In Colorado, twice as many men own compared to women. 1 in 4 owners are veterans. The large majority of 88% identify as white. 2 in 5 owners are between the ages of 35 and 54. And interestingly, almost half of the firearm owners in our state live in suburban areas. Finally, of those who have firearms in the home, almost 2 in 5 of those homes also have children in their homes. One important question we asked is whether Coloradans have taken a class on firearm safety previously. As you can see here, only 3 in 4 of those who personally own a firearm have taken a course, and only 63% of those who have a firearm in the home but didn't necessarily personally own had taken a course. We also asked why those who personally own firearms have made this choice, as individuals' reasons for owning can often influence their decision on how to store their firearms. As you can see here, Coloradans own firearms for a variety of reasons, but the idea of protecting themselves, their family, and their property largely rise to the surface as primary reasons. Given that we know that securely storing firearms can prevent theft and reduce the risk of injury or death in homes where there are firearms, we wanted to ask about what storage practices are used The gold standard for securely storing firearms is to keep all firearms in your home unloaded and locked in a safe case or using a different locking device. 65% of Coloradans report they use this gold standard and have all their firearms locked and unloaded. That means that over 1 in 3 homes in Colorado, however, do not use this gold standard of locking in and unloading all of their firearms. We also asked about what storage practices Coloradan homes with firearms used. Storage practices are similar for both those who have handguns and long guns. The most reported practice for both was a gun safe, which was 41% using for handguns and 44% for long guns. Keeping the guns unlocked but hidden, which was 43% for those with handguns versus 34% for those with long guns, and using a lock device with a key, pin, or dial, which was 25% for handguns and 17% for long guns. Note that very few individuals, towards the bottom here, reported that they store their firearms away from their homes. While we saw that less than 1% stored their firearms away from their homes, it is important to have a plan in place for temporary storage away from the home in the circumstance that someone becomes a threat to themselves or to others. However, only 1 in 4 Coloradans have a plan like this in place. There's also a map of firearm businesses and law enforcement agencies that provide on-site storage for families and individuals who want to temporarily and voluntarily store their firearms in Colorado. You can access this map through the QR code here. We wanted to know why people think it is important to lock their firearms in their homes to inform ongoing education and prevention opportunities. The majority indicated that they do so simply because it's important to keep firearms stored securely. The next top 2 reasons were to prevent theft and to prevent accidental injury or death. These may demonstrate how we can tailor those messages about the importance of using firearm locking devices to Coloradans with firearms in their home. As we consider what messages might be most effective in ensuring Coloradans with firearms in their homes are using secure storage practices, we also know that the person who delivers that message matters. We wanted to know who Coloradans who have firearms in their homes have heard promote secure storage in the past. Almost half have heard law enforcement give this message, with closer to 1 in 4 people saying they heard it from a firearm instructor or from a family member. But note here that over 1 in 3 people reported having never heard any of the messengers we listed here promote secure storage of firearms. We then asked whether Coloradans who had heard these groups talk about secure firearm storage before had made any changes to their behaviors as a result. Overall, 1 in 4 who chose any of the messengers promote the importance of secure firearm storage said they store their firearms more securely in the home as a result of that message. But while many had reported they heard this message from law enforcement the most in the past, what we see here is that people started more securely storing their firearms most often when it was teachers, friends, parents of children's friends, and family members who promoted securely storing firearms. We also think it's important to draw attention to the fact that while half of Coloradans believe it is appropriate for health professionals to talk to their patients about how firearms are stored, and even 42% of those with firearms in their homes thought that this message coming from healthcare providers was important, only 14% of Coloradans with firearms in the home report having heard healthcare providers promote secure storage of firearms. Overall, these findings suggest numerous opportunities for education and prevention for Coloradans who own firearms or have them in their homes. First, enhancing secure storage practices can prevent unauthorized access to firearms within homes and from visitors to those homes. Second, more education promoting the importance of secure firearm storage is needed, particularly to inform Coloradans about locking and unloading firearms as the gold standard, especially in situations where someone is a threat to themselves or others, there are children in the home, or individuals in the home might have dementia or other cognitive decline. Finally, it is important that we focus those messages and pair the messages with the right messenger. I will transition us now to understand more about the impact of firearm harms on Coloradans and what this means for prevention and education. Experiences and fears related to firearms for Coloradans are critical to decision-making, as they can have an enormous impact on the emotions, stress, and behaviors of individuals. Coloradans are concerned about many violent events that could occur. We asked about their concerns both within their local community and for themselves or their families. The events of highest concern, both for within their local community and within their families or for themselves, are mass shootings and school shootings. However, Coloradans' concerns about these events happening in their communities remain high for any event overall. In general, you can see that Coloradans are more concerned about violent events happening in their local community, which is in blue here, than to themselves or their family, which is in yellow. When you look a little deeper at concerns Coloradans have in their communities versus for themselves and their families, however, some interesting findings to note are actually related to youth. While 57% are concerned about suicide, 47% about accidental shootings, and 40% about homicides among youth in their local community, only 28% are concerned about suicide, 26% about accidental shootings, and 24% about homicides for youth when they consider those concerns for their own lives or their families. People's concerns about their risk of being injured or dying due to firearms is also interesting, given what the reality of the burden of these deaths are in Colorado. As you see on the right here, from 2017 to 2021, 75% of the deaths involving firearms were due to suicide, 20% from homicide, 1% were accidental shootings, 2% were police-involved shootings, and 1% were mass or school shootings. But as seen on the left, when we asked about what Coloradans believe to be the most common cause of death involving firearms, only 1 in 4 knew it was actually suicide. We wanted to ask Coloradans about what their actual experiences with firearm injuries and deaths were. Well, you see here that at the bottom that almost 6 in 10 people reported that either themselves or anyone in their close social circle of family and friends have not experienced any of these events. Almost 1 in 3 Coloradans shared they have experienced suicide in their close social circles, 11% a homicide, 9% spouse or partner violence, 7% gang violence, 6% accidental shootings, 4% police-involved shootings, 3% school shootings, and 2% mass shootings. The psychological impact of being the one to experience these events or have someone close to you experience these events is profound and a public health concern in and of itself. Finally, we wanted to see what steps Coloradans have taken to protect themselves if they were concerned about violent events occurring in their communities. Across all of those concerns we provided, we found that 1 in 3 people have avoided large crowds like music festivals, bars, or clubs. Many are also taking actions that involve additional focus on firearms, with 1 in 4 people having attended a firearms safety class or are practicing shooting, as well as talking to children or family members about firearm safety. An additional 17% of Coloradans report they have purchased a firearm to protect themselves against firearm violence. It is also important to note that despite many concerns in Colorado, over 1 in 3 people stated they have not made any changes to their life to protect themselves given those increased concerns. There are opportunities to ensure that Coloradans are aware of the primary issues that lead to injury and death involving firearms in Colorado. This awareness can help inspire action and lead to solutions that protect individuals, families, and communities from firearm misuse and related harms. We should ensure that the facts about firearm harms are part of education campaigns and reported on in non-sensationalized ways using best reporting practices and sensitive and relevant language. We can also support those who have experienced any of these events by providing resources that can help them to heal and protect themselves from ongoing harm. We asked several questions. The third part of our survey was that we asked several questions about Coloradans' perceptions of strategies and policies that help create protective environments. Protective environments support communities in accessing resources and assets and having regulations in place that can lead to a higher quality of life and reduce risk for firearm harms. Investing in, promoting, and implementing these solutions can lead to this long-term change. Overall, Coloradans support investing in the following resources and assets that help to create protective environments that have been shown to reduce violence and injury at the population level. Coloradans were most supportive of investing in access to quality education opportunities and access to quality healthcare, including mental and behavioral health, to improve their quality of life. But you can see that support is high overall for these important aspects of our lives: the environment, employment opportunities, civic engagement, transportation, and housing. We also asked about Coloradans' awareness of laws that are or could be in place to prevent firearm harms. Of laws that exist that we included here, which are in yellow, only 44% were aware of the safe storage law that holds firearm owners accountable for allowing unsupervised access to children or other users. 61% were aware of the lost or stolen firearms law, which requires people to report lost or stolen firearms to the police. And only 44% were aware of the Extreme Risk Protective Order, or ERPO, or red flag laws that allow individuals to ask a judge to sign an order barring an individual from having firearms if they are believed to be in immediate danger to themselves or to others. High level of Coloradans also believe that laws existed that do not exist in Colorado, as seen in red here. First, 9 in 10 people thought there are universal requirements for background checks for purchasing a firearm. While Colorado generally requires a background check in most circumstances, there are several exceptions. And then 8 in 10 individuals thought that there was a Colorado law that requires a background check prior to transferring a firearm to immediate family members, but that's actually an exception to that previous law. Given that if there is a situation where someone is in crisis and needs to temporarily and voluntarily remove their firearm from their home, and people typically trust their family members to hold those firearms for them, this exception can be used as actually a best practice in suicide prevention for those who own firearms. Finally, almost 8 in 10 people also thought there was a law in place requiring people to be added to a registry when they purchase a firearm. In fact, Colorado has a law that prohibits local and state government agencies from creating a registry of firearm purchases or transfers. We also asked about Coloradans' support for regulations that are intended to curb firearm-related misuse and harms. Of the policies that exist in Colorado, seen here in yellow, more than 8 in 10 people were supportive of these laws, with the exception of the prohibition of purchasing magazines that hold 10 or more rounds of ammunition. Of the policies that do not currently exist in Colorado, which are in red, there was high level support for several. 87% support requiring background checks before a person can obtain a permit to carry a concealed firearm. 84% support preventing persons with severe mental illness from owning firearms, and 77% support requiring a firearm safety course before the purchase of a firearm. 7 in 10 Coloradans also support requiring permits to purchase a firearm and to open carry. Given national and Colorado attention to ERPOs, as previously mentioned, we also asked about when Coloradans feel it is appropriate for an ERPO to be issued. Overall, 65% agreed that in any scenario listed, an ERPO could be issued, but support for issuing an ERPO was highest when a person had threatened to physically hurt a group of people or had physically hurt you or someone else. These findings help us to understand where Coloradans believe we can invest to enhance resources and assets that can prevent communities from experiencing firearm harms, injury, or violence. As the COPIP's findings demonstrate, there are many areas where practices and policies exist already to protect Coloradans from firearm harms. More education is needed about many of these strategies and regulations. These findings also provide information to help inform people's perspectives about some of the potential investments and regulations that may be feasible to many Coloradans. Given all I have presented on today, what does this all mean from where we all go from here? First, we hope you can use these findings to inform you take as an individual or organization to address firearm injury and violence. While we only presented on state level findings today, we also have regional data that provide a more focused understanding of how Coloradans in 4 different regions feel about the impact and prevention of firearm harms. As an individual, you can certainly take steps that are supported by these data. For example, if you are a parent and your child is going to a friend's home, you can take that step of having a conversation to make sure that home is storing their firearms securely while your child is present if they have firearms. If you're a healthcare provider, consider asking about storage and providing education to patients or parents of patients. If you're a firearm owner or there is a firearm in your home, learn more about secure storage practices for your firearms and make a plan about how you would temporarily store your firearms if you ever have a circumstance in your family where it's needed. These findings can also inform the practices of community organizations or government agencies to address firearm injury and violence. Organizations can use these data to apply for funding to advance their efforts to prevent firearm harms in their communities and to make data-driven decisions about what these programs or strategies could be that would help to prevent these harms. Even if your organization or agency doesn't currently address firearm harms, if you are working in an area related to firearm injury and violence, such as education, healthcare, employment, housing, or the environment, there are opportunities for you to expand your work and impact by integrating a focus on preventing firearm harms. To inform your individual and organizational efforts, we encourage you to access additional resources currently available on the COFIPS website, including a downloadable data set and brief data reports on key issues. While there are resources already available to you on the COFIPS website now, we are working very hard to also produce additional resources, including more brief reports, peer-reviewed publications, and a dashboard to more easily view and use the data. To learn more about when we release these data products, please sign up for the CU Firearm Injury Prevention Initiative newsletter here with this QR code. We will announce these as they are available. Finally, as a reminder, we will administer COFIPS again this year, but this year it will be a specialty survey to a group of particular interest to understand the burden and prevention opportunities of firearm harms. We're currently determining the focus of this survey. Next year, we will once again repeat this iteration of the core survey so we can monitor the trends or changes in what we have discussed today. We are so grateful for your time, your interest in this topic today, and believe these data can help us to collectively address and prevent firearm harms in Colorado. While I was fortunate to present today, there are many people involved in this project. I'm so grateful for their time and commitment to this important work, and their names are listed here. Once again, please access the 50 newsletter here. And there's also a contact form on the COFIPS website you can fill out to connect with one of our team members or make additional data requests. Thank you so much for your time.
Okay. Thank you, Dr. Kelly. So we have got some time for a question and answer. For those of you less familiar with the Zoom platform, there is a Q&A tab that you can click on to post questions, and we will get to those as time allows. So go ahead and post away, and we'll get to the few that are already posted there in a minute. Dr. Kelly, I had a question for you. You mentioned earlier that now we're the only third state to actually have data like this. And now seeing your presentation, it seems so critical to actually understand some of this information if you're going to think about how you're going to make policy or intervention changes and think about preventing some of these harms. Can you talk a little bit about the effort that went into this? You presented so much there, but like who was involved and how much of a lift is this if, you know, another state in the United States wants to do something similar to this?
Yeah, that's a great question. It is a lift. So I would say that the easiest part of this is actually contracting with a firm who had connections with participants who could take the survey. And I would generally say depends on the state and the amount of people, but plan for 200,000 or less if you are interested in kind of doing that piece. But the bigger lift is really in the developing the survey, in analyzing the survey, and then creating these dissemination products that we're doing today. You saw the whole name of people here, but we had multiple people involved in that. We had incredible support from a state office, which I know not all states have in existence at this point in time as well. But I think it takes that kind of backbone infrastructure and investing in data infrastructure from the states themselves as well. And then we did a lot of work too to make sure that the way that we asked questions were appropriate for different people to be receiving that information as well. So there's a lot of work that happens behind the scenes, but I will say that I think any of us would say it's very worth it. And we're so thrilled that we can provide these to Colorado to really facilitate local action.
Great, thank you. So let's get to some of the questions. Sabrina Arredondo Matson said, great presentation. What's the response rate for the survey?
So because we weighted these data, the response rate is not, it doesn't matter as much essentially as it would in a typical survey administration, because the data were weighted to represent the adult population in those regional populations in Colorado. So I don't actually have what the response rate was to it, but that's partially because it was intentional recruitment to make sure that we had demographic and geographic representation of Coloradans and within those regions specifically.
Okay. And Emma Bernick asked, were there any questions asked on the survey about whether children and youth in the home had access to firearms, knew where firearms were stored, or knew how to use a firearm?
That's a great question. Thank you for it. So this was a survey just to adult residents of Colorado. So we don't have information that paired to how youth were able to access or if they knew about it as well. That said, the Healthy Kids Colorado survey does ask 2 questions related to firearm access, just ease of access essentially and amount of time they could access it. And then also this year they added a question to ask where they could access firearms. So there's this different survey that asks questions of youth specifically.
Dwayne Smith asked, in our rural county, the local SO offers monthly concealed carry classes where the seats available for participation are nearly always full. Is there any correlation between the number of people completing a concealed carry training with a reduction in firearm injuries within the community?
Thank you so much for that question. I think this is a great point broadly, because I think it demonstrates how research and practice related to preventing firearm injuries are happening simultaneously. So I think that a lot of people, especially the firearms community themselves, really believe about the importance of these training courses, but there hasn't been a lot of research on how effective these training courses are in actually preventing injury and death. So if there are other research on the call, I think this is an opportunity that many are interested in pursuing to see what that could be like at this point. But I think the idea here is that education and getting the message out around secure storage as a good practice is important regardless, but there is more research needed to answer that question specifically.
Okay. And there's a comment here about the availability of the slide deck, as well as to go back and see some of the slides. You had mentioned that some of these resources were available at the COFIPS, I think COFIPS site. Is the slide deck also available?
I believe we can make that available. We'll make sure we send an email out after the fact. The webinar itself, the recording will be available for sure, and we'll let you know if we can make the slides available as well.
Okay. Sorry, I'm going a little bit out of order here. Sarah Hameda, I'm sorry if that was the incorrect pronunciation of your name. Which survey findings were the most surprising for your team? And which policies do you plan to advance first after collecting these data? So what was surprising and which policies do you plan to advance?
That's a great question. I would say, so the word surprising is what throws me a little bit here. In some sense, some of the data around what we know about ownership and storage practices resonate deeply with what we know at the national or kind of comparable study level. But what's important is, I think, the comprehensive nature of this survey and how much it adds to any level of knowledge we have. I know Dr. Simonetti mentioned this up front, but we don't really have a lot of data about most of the topics we put in here today. So in some sense, it's a surprise because it's the first time we can say at a state level or even these regional levels that this is what Coloradans say. And I think that in and of itself is just beautiful, not necessarily surprising, but the ability to have that and use those are really important. And then the second half of your question too, was
about policies that you plan to advance.
That's a great question for us. So we feel at the Firearm Injury Prevention Initiative that we really take a neutral, collaborative approach to this work, and our job is really to educate everyone about what we found in this survey that inspires action. So I would put that back onto you all, to policymakers, to people doing the work on the ground to prevent this. That we're here to be a resource to you to talk through the data and understand what it means, what it could mean for prevention and practice. And we certainly do a ton of education around a lot of what we talked about today. But in the policy realm specifically, that's where we can provide education for people to be informed about what could come next.
Thank you. And I think Fran Samtagara had a very similar question about encouraging public health departments. So I think that the same answer, I think, is relevant for that question. Christine Demont asked, do you know how Colorado compares to California and New Jersey in terms of percent having a firearm in the home?
I do not off the top of my head. Joe, do you at all? Or
Yeah, I was actually just looking at them when I saw the question posed. California's sort of parallel survey is the California Health Interview Survey, I believe. And I'm looking at their data brief right now, which found that 17.6% of California adults in that survey year kept a firearm at home. So 17.6, and I will sort of caveat that by saying I don't have their survey immediately in front of me, and there can be some nuances in terms of how firearm access is asked about that can sort of impact these percentages. But at least per this writing of this data brief, 17.6% kept a firearm at home. That's for California. I don't have the New Jersey data in front of me. Dun, dun, dun. An anonymous attendee asked, is youth one of the groups that might be surveyed in the even years? And you mentioned this sort of another response, but we come back to it.
Yeah, it's a great question, and honestly one that I think we are thinking deeply about, because we agree that that is an important group to be asking questions of and understanding where they think there are prevention opportunities as well. They're a little bit trickier to survey just from kind of our perspective, mostly because it's hard to access them uniformly. Again, the Healthy Kids Colorado survey did add in a few questions, which is a representative survey of youth in Colorado. So we think that that's a starting place, but we hope to dig in more as to whether or not that can be a group we can work with in the future.
And Cooper Dayton asked, were there any data on the types of firearms owned? I know you had presented some information about handguns versus other guns, but this question gets into more specific things about AR platform firearms, semi-automatic, pump action, the caliber owned. So some more granular details about the types of firearms that individuals have access to or own.
Also a great question. We only asked about handguns and long guns broadly, and part of that is about feedback of creating a sensitive survey that people will respond to accurately. So trying to kind of make sure that we weren't asking very specific questions that might trigger anyone in their response. So only handguns and long guns broadly.
And Anna Abrams asked about police-involved shootings and how national data sets tend to underreport them. And her question was about, is there any support to more accurately track and report police-involved injuries, shootings, and deaths, given that your survey has now demonstrated sort of high rates of concern about that outcome in the Colorado community?
Also a great question. And again, I think highlights what we can do to provide this information. If this is of interest for those agencies that might be able to track that, that's where we can serve as a partner in thinking about what this means and what that could look like as well. But I think that's a great example of an opportunity for work that could happen in the future to accurately track information.
And Jamie Rodriguez said, I noticed the use of cable locks was low. Do we know anything about why? It seems to be the most available, easiest accessible, questionable, cheap option for locking devices. And I'll leave it at that. Do we know why?
I don't know if we know exactly why, but I think we could speak somewhat anecdotally to that, which is that it's just not the preferred version of it. it is, as you've kind of said here, it's cheap and easily accessible, but it's not what people would broadly use in homes. So I think that's part of where we are trying to kind of push efforts at this point in time as well, of what is the preferred locking device for people, and how do we ensure that they can access what that preferred method is.
More here. Tate Steedley asked, can you speak to any insights based on how people assessed risk perceptions and how often they used their firearms? It was interesting to see how many people say they used firearms about once per year. So I guess there's a correlation between risk perceptions and how often they use their firearms.
Wonderful question. And I would say that these are the analyses you're asking for here are some of those that are coming up next, of how did we look at essentially what different, both demographic groups, but what people might have said about what issue and what that means for what they might have thought about a different issue. So that the kind of belief systems that they had related to access and storage and association with firearm risks is one of those interesting factors that we're looking at to see how it informs those practices. So coming.
Thank you. And Christine Multiapole, sorry if that was incorrect, asked, thanks for this presentation, Aaron. Do you have any concerns? So this is basically a survey methodology question. Do you have any concerns about selection bias among respondents? We know that certain types of firearm owners are more opposed to public institutions having information like this, and maybe therefore less likely to participate in this survey.
Yeah, I would say I do not have concerns about that necessarily. I think in general, surveys have been shown that people accurately respond to them. It is part of why we take so much care in how we ask and what we ask of our survey questions, though, because we want people to feel comfortable responding. So there weren't questions like, how many firearms do you own? Those types of different firearms, stuff like that. That's a great example of why we tried to be really cautious about how we asked questions in those ways, and why we work with partners to ensure that we can ask those sensitive questions.
And Shiv Sanger asked, is there a list of statewide resources or community organizations that work with families to prevent deaths?
Great question. I know that in partnership with the Office of Gun Violence Prevention, we're trying to figure out a way to make those organizations available to folks. But I would actually expand that question a little bit to something I tried to draw attention to as well, which is that I think there are efforts of many organizations to very proximally try to prevent any firearm related injuries or deaths. But I hope that other organizations can see themselves in the work that we have to do, given that nature of providing those additional resources and assets. So if you think about it, many communities are rife with those resources. It's about promoting those and connecting youth and those who need those resources to them. So whether that's environmental or civic engagement, transportation, housing, all of those things I think add up to really ensure that we're preventing these injuries and deaths. So I think we can think more explicitly around connecting those groups together and making a broader interface for this in Colorado. And I know lots of people are very excited and interested in jumping on board to make sure that those organizations feel supported and are known.
That's a great response. Oftentimes, the many things that are happening in communities to prevent firearm injuries aren't labeled as such. And many times people delivering those services or even receiving those services don't realize that somewhere downstream, that's exactly what's happening, which is the prevention of injury. Elena Smart asked about smart guns or personalized firearms. And whether or not you considered assessing attitudes about smart guns or personalized guns.
Great question as well. So I think those are also referred to as biometric devices, just to kind of connect some dots for folks too. This is just a limitation in how many survey questions you can ask. I think given this was the first attempt to try to find some information comprehensively, both about the impact of and prevention of firearm harms, we couldn't ask every single question we wanted to. So that could be an opportunity for one of those future surveys, an additional question, but we did not ask specifically around that in this survey.
Okay. And I think as we're wrapping up, Sarah Leslie asked, I also said, awesome presentation, thank you. But then asked, similar to another question, in terms of dissemination to the public, what's next?
Great question. We love this question. So it was very important for us to get the findings out to you all. And I know that we're working hard to kind of produce more. So you would have seen QR codes. There are currently 2 data briefs available to you. And the data set itself is downloadable at this point in time. And there's opportunities to filter those data to kind of see those different geographic or demographic breakdowns, which are particularly compelling. We're hoping to get data briefs out quite regularly from here. Hopefully 1 to 2 a month. And then we're also working quite ambitiously on several peer-reviewed publications that we would make a kind of friendlier version that's downloadable, as well as a brief report of what those findings are in those 2. And then I think the biggest thing that we're working on is a dashboard that allows you to both download and visualize some of these data too, so that they're accessible. But the most important part of any data to me are about what happens as a result of the data. So again, highlighting that I think we wanted to present these to you so that you all can take them and do with what you wish. I highlighted at the end, but I think there's lots of individual calls of actions, which is sometimes unique. You don't always see that. And so I think that's something that we can process as a society and as a single human being in this state, but also that I think organizations can use these to really get up and running, that I hope these get out to our decision makers as well. And I think there's lots of opportunity for collective action with these.
Okay. With that, I think it's time for us to wrap up for the day. We did have some more sort of technical questions about survey administration, which I thought we could sort of leave to the background. So if those individuals want to contact us, or we could do the same, we can answer some of those questions. But I think that's a good place for us to wrap up in terms of talking about next steps. Dr. Kelly, I want to thank you for being here today. I think this has just been a tremendous effort, and it is so critical for Colorado to have this information, to do that, to think about what's next. And so thank you for this work, and thank you for presenting it to us. Everybody have a nice day.